Breast augmentation, affordable cosmetic plastic surgery Philippines. Breast augmentation, technically known as augmentation mammoplasty, is a surgical procedure that enhances the size and shape of a woman's breast with the use of breast implant, silicone or saline. The procedure also enhances breast contour and volume after pregnancy. Breast implant is composed of silicone gel or saline within a silicone shell. Breast implant is different from silicone oil. Most cosmetic plastic surgeon all over the world doesn't do silicone oil injection of breast to enhance breast size and volume. This technique is condemned both locally and internationally by most surgeons, since the results are unpredictable and compounded by numerous complications such as extrusion, skin necrosis and infection. Patients should not allow themselves to be subjected to this procedure, because the risk for unwanted complication is very high and results are deforming or unpredictable. Most surgeon uses breast implant which is composed of material that is non-toxic, non-allergenic, non-teratogenic and biocompatible to human tissues and thus have less risk for any unwanted results and with more predictable outcome. This is one of the most common cosmetic procedures done worldwide, especially in the United States. It is a straightforward procedure with a very instantaneous and pleasing result. Because of this, the public's attention and interest focused on the search of a very safe breast implant material. Breast augmentation is the only procedure in cosmetic plastic surgery specialty that is surrounded by controversy and scrutiny. In the past, especially during the late 70s and early 80s, a lot of medical conditions such as breast cancer and autoimmune disease was wrongfully associated with the use of silicone implant. Because of this, the U.S. Food and Drug Administration had regulated the use of silicone breast implant for cosmetic breast procedures until recently in mid-2007. After extensive clinical research study that included more than 1,000 breast-augmented women, it was found out that silicone breast implant does not cause any malignant disease or breast cancer or any autoimmune disorder. Because of this, the U.S. FDA had approved the use of silicone implant in cosmetic breast procedure. There are two basic types of breast implants, saline or silicone implants. The implant is composed of an outer membrane composed of silicone shell. This shell contains either saline fluid or silicone cohesive gel material. It is prudent for every patient to discuss extensively the advantage and disadvantage of each implant type with their surgeon before they finalize their decision. I perform my breast augmentation procedure under deep sedation with local anesthesia or general anesthesia. The procedure can be done either as an outpatient surgery or patient can be admitted or confined for a day or two in a hospital, depending on the surgeon and patient's preference. Whether the procedure will be performed as an outpatient or as a hospital procedure, preoperative laboratory and medical clearance is required. The surgery usually takes 1 to 2 hours to complete. The breast implant can be inserted through an incision at armpit or breast folds or at the areolar border. Each choice of incision site has its own advantage and disadvantage in terms of scar cosmesis and nipple sensation. And among the three incisions, the transaxillary approach has the best scar cosmesis since it is concealed and nipple sensation is well preserved. But it is advisable to the patient to further discuss this issue if ever scarring will be a significant concern. After the procedure there will be some swelling and mild bruising that last for several days to few weeks, and this is only a transient changes. Patient is required to wear breast binder for 3 to 6 weeks. This will hold the breast implant in place during the healing process and also help control the swelling. Sutures are removed after 7 to 10 days. Any patient planning to have this procedure will require 10 to 14 days for the initial consultation, laboratory, medical clearance, surgery, follow-up, suture removal and early recuperation. After this, patient is safe to travel since wounds are dry and healed.